Good morning from St. Louis, and hello to everyone who joined today, the second day of the Purina Institute Global Virtual Event, Microbiome Forum, when we're talking about putting microbiome science into clinical practice. Myself, Natalia Wagemans, and Dr. Suchodolski, we welcome you and we wish you to stay with us for the few hours to discuss how we can use a lot of technical knowledge that is aware in this world about the microbiome and put them into the clinical practice. And actually, that was the mission of the Purina Institute, how we can take a power of nutrition science and introduce that into the clinical practice to make sure that veterinarians around the world and members of veterinary healthcare teams, they can be more successful with the nutrition knowledge to manage health and disease of their patients. You can find a lot of information on the purinainstitute.com, where we put a different science on nutrition, but also a lot of science related to the microbiome. And one of the resources I would like to share with you today is a clinical nutrition handbook. I believe that majority of you have it at your disposal, but I would like to remind you that this book now is available in 7 languages. And this is very important because world speak more languages than just English. And this is as the example, I share with you an article from Dr. Suchodolski, who is talking about accessing and managing the gut microbiome in canine and feline practice. You know, importance of this book is that not only 40 global experts, they put their knowledge and expertise and opinions in this book, but also because this book gives you a practical advice, it gives you communication tips and the messages you have to take over and carry on. And this gives me a great opportunity to introduce Dr. Suchodolski. He was graduated as a veterinary degree in the University of Veterinary Medicine in Vienna, Austria. He followed several years in clinical practice, and then he returned back to academia and decided to dedicate his professional life to veterinary microbiology from Texas A&M University, where he's up till now working in the different capacities. He's board certified in immunology by American College of Veterinary Microbiologists, currently serves as a professor and associate director of the GI lab at the Texas A&M University, and he's heavily and actively publishing over 340, and probably while I'm talking now, there is another few manuscripts are getting ready to be published, and all those manuscripts in the field of veterinary gastroenterology and the microbiome. And Dr. Suchodolski currently has a position of Purina Pet Care Endowed Chair in the microbiome research. Dr. Suchodolski, stage is yours.
Thank you so much, Natalia, and welcome everyone back. It's the second day today. I can also not believe it's the 4th annual, event, the microbiome science, and how do we put this in clinical practice? And I think that is really what we're trying to do. I think the microbiome is really crucial. The microbiome is something we always treated. Back then, we just didn't name it differently. But it really becomes very clear that the microbiome is part of GI physiology. It has really impact on many different organ systems, also beyond the GI tract. And the bottom line is that we need to understand how to manage it. And we heard yesterday that diet is very crucial. Diet is probably the major way of modeling the gut microbiome. And then we often add some, if needed, some micromodulating therapies. And as you can see, today we're going to speak a little bit more about how can we actually avoid antibiotics? Why can we avoid it? Why should we avoid antibiotics? Obviously, antibiotic resistance is a big problem, but also we know that antibiotics really have a more negative effect short-term, but potentially can be risk factors than long-term. So Dr. Linda Thorsen is going to present us to a little bit about how we can actually switch from antibiotic to more microbiota-friendly treatments in chronic diarrhea. We're going to hear a little bit later also what is the impact, especially in cats. Cats appear to be very sensitive to antibiotics. So Sarah Belchick who's going to tell us a little bit afterwards about what's the impact of antibiotics on cats, and ultimately also what actually does it mean if we have a clear dysbiosis. Once we have clear dysbiosis, we also know that the function of the gut microbiota is altered, and we're going to talk about this a little bit and try to summarize yesterday's and today's talks. And then two talks that are important, I think, for the future. I think we're also understanding the tryptophan metabolism, so some essential dietary nutrients, they're ultimately important for the host, but also for the gut microbiome, and they really are important for inflammation or anti-inflammatory components, changing the gut barrier and things like that. So really this is a tryptophan and indole metabolites presented by Patrick Barker is going to be important. And then something that is really, I think, something that we don't think about a lot, but I'm really excited about the talk from Jennifer Reinhardt, because in the end, don't forget, the microbiome is a metabolic organ. And so that means is everything that enters the GI tract and gets exposed to bacteria gets ultimately metabolized. And that's not just diet, but also any drug medications and so on. So I'm excited about this one too.